Hi, my name is Ellie Forbes. My student number is 103646986, and this is an oral presentation and patient case study on polycystic ovary syndrome, or otherwise known as PCOS. For the patient case, we have the following. Alexandra is a 25-year-old female university student who currently lives with her sister in an apartment in which they rent. Alexandra has come to the emergency department with severe cramping, heavy menstrual bleeding, and nausea. She says she always has had a irregular, heavy period and also has bad cramps, but nothing that she usually can't handle. However, her recent menstrual symptoms have been getting worse. She's stating that she's in immense pain, but does not understand why it has gotten so bad. Upon appearance, Alexandra is on the heavier side. She has thinning hair, an increase in facial and body hair, as well as moderate acne. A blood test to test the levels of androgens and an ultrasound of her uterus and ovaries were conducted. After speaking with the doctor and confirming the tests positive for high androgens and cysts on the ovaries, Alexandra has been diagnosed with polycystic ovary syndrome. In 2019, Johns Hopkins Medicine defined polycystic ovary syndrome as a condition where the ovaries produce an abnormal amount of androgens. Androgens, such as testosterone, are a sex hormone. They help people with entering puberty and maturing physically, as said by the Cleveland Clinic in 2021. Typically, females produce a small amount while males produce a larger amount. When a male has low androgen levels, it can be the cause of low sex drive, as well as gynecomastia, otherwise known as male breasts, while in a female with high androgen levels, they can develop facial hair and acne, as outlined in 2021 by the Cleveland Clinic. To be diagnosed with polycystic ovary syndrome, generally patients must meet two of the three criteria. Garg and Tal in 2016 outline that the criteria such as oligo or anovulation, which is the lack of or the very irregular ovulations, the clinical or biochemical hyperandrogenism, and polycystic ovaries as being the third criteria. In Alexandra's case, the clinical and biochemical hyperandrogenism and polycystic ovaries are present. Genetics can play a factor into PCOS as it is largely familial. However, the etiology and pathogenesis of polycystic ovary syndrome still remains largely unknown, and it's continuing to be researched to this day. The Mayo Clinic in 2017 state that signs of PCOS generally develop around the time of a woman's first menstrual cycle, or otherwise known as a period. PCOS can present in different ways and degrees of seriousness. Depending on the levels of androgens in the body, this can vary. Symptoms, as outlined by the Mayo Clinic in 2017, can include excess body hair, irregular periods, heavy periods, and severe acne. The NHS choices in 2019 add on to this list by stating that weight gain and loss of hair on the head can also be symptoms as well. Symptoms are usually described among social circles as being extremely painful and uncomfortable. They can be debilitating and reduce one's desire to go about their lives as compared to somebody with a normal period may go about it. Some women, such as Alexandra, come into the emergency department to help manage their pain, as well as a little bit of their symptoms, but mostly the pain, which becomes too much for them to be able to handle at home. PCOS is more common than one may think, with Grigorescu et al. In 2016 reporting that every 1 in 10 women are affected by the syndrome, whereas Liao et al. In 2021 put it as affecting 6 to 10% of women. Most women diagnosed with PCOS are between 15 and 44. However, they mainly tend to find out their diagnosis in their 20s and 30s, as reported by Grigorescu et al. In 2016. While PCOS can be managed with the added risks, some patients may develop endometrial cancer. Sometimes the solution to very, very severe cases is a hysterectomy, which is a total removal of the female reproductive organs. There is an annual average of almost 31,000 hysterectomies for women above the age of 25, as detailed in 2017 by Wilson et al. Potential issues with polycystic ovary syndrome can be a multitude of things. According to Better Health in 2019, some potential complications can be insulin resistance, cardiovascular disease, depression, anxiety, eating disorders, as well as endometrial or uterine cancer being the most severe. One of the issues that can arise from PCOS, as stated earlier, is depression, anxiety, and eating disorders. As stated a little bit earlier in this presentation, weight gain, acne, excess facial body hair can happen with PCOS. These are all points of concern for women as they go without outside of the beauty standard that is within society. This can be very difficult for women to handle, both mentally and physically as well. Tay et al. State in 2019 low self esteem and psychological distress are highly correlated with PCOS and further increase the risk of eating disorders. To maintain weight, women with PCOS can develop unhealthy eating disorders. Some may restrict their intake, overfixate, or even binge as well. Kerr et al. In 2019 state that physical appearances like acne, excess body hair, and obesity can help aid in creating a negative body image and low self esteem, which can in turn lead to anxiety, depression, and very severe eating disorders. A second complication that may arise from PCOS could be endometrial cancer. This is a cancer which can form in the linings of the uterus, cervix, and ovaries. Some ways to rid the body of such cancer can be a hysterectomy, as stated earlier, is a total removal of the female reproductive organs. Harris and Terry state in 2016 that multiple studies have reported that women with PCOS are at higher risks of developing endometriosal cancer. Alongside this, Njaki in 2019 state that endometriosal cancer is linked with obesity. Women with PCOS are at high risks, but adding that extra risk that comes with obesity can be avoided. A manageable solution to prevent something such as an irreversible thing as a hysterectomy, making it so that women can no longer have children, it can be avoided, and something like this must be taken seriously, and instead we must find and use a preventative measure. Nursing interventions for both anxiety, depression, and eating disorders and endometrial cancer are very similar. For anxiety, eating disorders, and depression, a nurse's role in intervention could firstly be to be a safe and trusted member for the patient, in this case Alexandra, to go to regarding concerns and questions about her new diagnosis. A nurse can be the link between Alexandra and speaking to a nutritionist and getting started on a meal plan, a psychiatrist, and helping deal with body dysmorphia should she develop it, or should she develop eating habits that are not healthy. Personal trainer to get started with a manageable workout plan. However, even just starting with walking for 30 minutes to an hour, just to get that exercise in throughout the week, can be used as well. A dermatologist to help get her acne under control as well could help Alexandra a long way. As stated earlier, anxiety, depression, and eating disorders are closely linked with polycystic ovary syndrome, as it does affect a woman's self-esteem and the images of themselves. While these will not cure Alexandra, they will help the overall surface level problems and help ease everyday life and take some of that pressure off her, helping to prevent her from developing some over anxiety, depression, and eating disorders about her looks. Nursing interventions for endometriosal cancer can be to encourage and educate Alexandra to set up half-yearly appointments to be screened for endometriosal cancer, ensure that she has the education and the framework to exercise and eat healthy on a manageable timetable and framework. As stated earlier, obesity is a very big factor in raising the statistics for complications of polycystic ovary syndrome. So keeping her weight under control is key. Goals of these interventions can be to go see a dermatologist, nutritionist, Exercise 5 days a week, minimum for about 30 minutes to an hour. Get screened at least twice yearly for endometrial cancer. Help create a balanced and manageable healthy diet. Half-yearly check-ins with Alexandra and her GP, or even the nurse as well, will be a perfect way to track her progress and her mental and general health as well. At least that way, when that does happen, plans can be adjusted, and they also have time to do what they are supposed to do and work. Giving her these tools to manage the syndrome on a day-to-day basis on her own, but knowing that she has that framework and that stability behind her with her team will give her the independence and confidence to be able to deal with polycystic ovary syndrome on her own. Here we go with some references for the presentation that I have just given. There's also a list in the Word document that is linked with this PowerPoint presentation. Thank you for your time, and this has been a presentation on polycystic ovary syndrome by Ellie Forbes, and my student number again is 103646986. Thank you.